reasons that when somebody has Hodgkin lymphoma, the cancer cell can move around in the lymph node, and we want to treat with kind of a security margin around the lymph node that has cancer. BrachyTherapy gives a kind of a pinpointed dose of radiation to a small area. So in Hodgkin, it's not usually indicated because you want to treat kind of a larger area. So you usually use chemotherapy and external radiation.
Okay, needs to be a localized area then for the brachytherapy. Okay. Next caller, go ahead. What is your question for Dr. Zouain this evening?
Well, I have lupus. Okay, and the cells attack themselves. I go in and out of remission, you know, and I'm wondering if any type of, you know, something like that would help. Would it be possible to try it? Because lupus is a terminal illness. You know, I have to live with it for the rest of my life. But I'd like an answer on that. I don't know.
No,
is there any application for, thank you, caller, for that.
Usually we don't use radiation for lupus. Actually, sometimes, unfortunately, radiation can make lupus worse. So if somebody unfortunately has lupus and they have cancer, usually we try to avoid, especially if the lupus is active, we try to avoid radiation because that can make the lupus worse.
So if somebody has cancer and lupus, what would be a course of treatment for that cancer?
It depends on the type of cancer. We try to use chemotherapy or surgery. But we try to avoid the radiation. Sometimes we have no choice. We have to, you know, accept the side effect of the radiation and go ahead if there is no way around that. But we try to avoid it usually.
Okay. We have to take a break. We'll be back with more of your calls right after this. We're back with Health Talk. Our topic is brachytherapy. That's high-dose radiation for certain types of cancer. This is Dr. Nicolas Zouain from MeritCare, and he's taking your questions, and we do have a couple of folks waiting, so we will go to them. Caller, what's your question for Dr. Zouain this evening?
I have a relative that has stomach cancer, and they went in, gave him chemotherapy, then they went in and was going to remove his stomach, and they found that he has cancer in the abdominal area. Is this internal radiation something that would help him?
No, since it seems that, you know, the cancer is spread out in more than one area, we cannot usually use brachytherapy for that. Usually brachytherapy, in general, we don't use it for stomach cancer, even if it's localized. So it's not tested. We didn't do any research on that, so we don't use it for stomach cancer.
Okay, caller, thank you for that. Let's go to our next caller. Go ahead. You're on Health Talk. What's your question tonight?
I have a question about colon cancer. Can this therapy be used for colon cancer as well?
So usually for colon cancer, we don't use it except for rectal cancer, which is, you know, the last part of the colon. We can use it in certain situations, but not for colon cancer.
Do you think at some point brachytherapy will be available in some of these other treatments, or is that just something, it's the nature of the cancer itself that it won't be applicable for that?
No, it's not really the nature of the cancer, it's how to get the source safely to the organ you want to treat. So if it's a deep organ, we want applicators that we can put safely inside that tumor to treat it. So stomach cancer, for example, and colon cancer, we don't have those applicators yet to do that. So because usually we don't put the source directly inside the tumor. What we do, we put kind of a plastic applicators inside the tumor if it's a prostate or breast or any type of accessible tumor, and then the patient will go to the room. During the treatment is like 5 to 10 minutes, and then when the patient by himself or herself in the room, the source of radiation will go inside the applicator. It's controlled by a computer system to treat the tumor. So we need also to develop more applicators to treat more type of cancer.
Can you talk about what the patient experiences in comparison, brachytherapy compared to radiation therapy, in terms of what they feel like when they're going through the procedure itself, and then after any side effects that follow after? Compare the two if you would.
Yeah, the external radiation is a non-invasive technique. It's like having X-ray. So the patient laying down on a table, it's non-invasive, and there's a machine that's giving radiation. Brachytherapy is more invasive, but usually it's minimally invasive, so we don't need major surgery to do it. But usually we need to get those applicators inside the tumor. Let's say if it's a prostate cancer, we bring the patient to the operating room, and under spinal anesthesia, we're going to put the prostate. And then the patient usually will undergo a CAT scan that prepare for the brachytherapy. And then the patient will wait for, a couple of hours while we're doing the treatment plan. And then at the end, we do the treatments that take like 15 minutes. So usually the patient will spend 2-3 hours in the hospital, but it's usually done as outpatient, so the patient will go home same day. External radiation is usually only 10 minutes per day, and the patient will go home right away after that. The side effect of the radiation and external radiation are a little bit identical because they depend exactly where we give the radiation. Meaning, let's say if we're treating a man with a prostate cancer, since next to the prostate we have the rectum and bladder, so by giving external radiation to the prostate, we irritate those two organs because the radiation has to cross those normal organs to get to the prostate. Brachytherapy carries side effect like, putting the implant in, but the patient usually will have painkiller, will be under spinal anesthesia, so usually they shouldn't feel too much pain. And then the treatment is not painful. And the side effects usually are less than external radiation because the radiation is limited to the organ. So the fall off of the dose is really fast, meaning if we are a little bit away from the source of radiation, the amount of radiation that is reaching the normal organ is very, very tiny. So the side effects are very limited.
Very limited. All right. We will go back to the phones. I would like to remind our viewers when you are up and we go to you, if you would make sure to turn your television down just while your question is being asked, and then you can turn it back up to hear the answer. So, next caller, go ahead. You are on Health Talk. What's your question this evening?
Is that me?
That is you, sir. Go ahead.
Okay. In 2001, I was diagnosed with clear cell carcinoma of the kidney. They took the kidney out, and the doctors at Roger Maris said it would be back 8 to 16 months. I went through 2 sessions of treatment in Milwaukee in a study where they did infusions. If this does come back, is this some kind of a treatment that would help me?
Yeah, hopefully it will not come back, and you don't have to go any more treatments, but if it comes back, it really depends where it came back. And then a different option could be considered at that time. Sometimes we use systemic treatment like chemotherapy or some different type of immune therapy. Sometimes we have to use the radiation because some organs, the chemotherapy cannot reach them safely or not with amount dosage. Let's say if the cancer comes back in the bones, and sometimes we use external radiation instead of chemo or a combination of both. So it really depends where it comes back, but hopefully it will never come back and you don't have to undergo any treatment.
All right. Caller, thank you for that. Good luck to you. And we're going to take one more break here, and we'll be back with more after this. Back with our final segment of Health Talk on brachytherapy. And Dr. Zouain, you and I had spoke earlier. You said that there is a palliative aspect to brachytherapy as well. You want to explain that?
Yes, sometimes we use brachytherapy not to cure somebody from cancer, but if the cancer is metastatic and it's not curable, but there is symptoms that are induced by the cancer that could be palliated and mean to induce more comfort and better quality of life for the patient. Let's say if we have a tumor that is almost blocking a esophageal tumor, or the patient not able to swallow well, or a tumor in the lungs that's almost blocking the airway, that want to keep it open so the patient can breathe better, or sometimes perhaps endometrial tumor, so a cancer of the uterus that is bleeding, that we want to try to stop the bleeding. So sometimes we use brachytherapy as a way to palliate the pain and to induce better comfort for the patient.
Okay. We have sort of a, not related to palliative, but mentioning uterine cancer. Our next caller wants to ask about that. Caller, what's your question for the doctor tonight? Go ahead, caller.
Yes, I have uterine cancer, and it had also metastasized into a hip joint, and I was wondering if this would be a therapy that could be used for that.
I think probably you underwent surgery. I'm not sure about that, but it depends on the site where it's metastasized, but usually we use more chemotherapy to palliate and and sometimes more external radiation. But if a woman did not undergo